Sadly, Maine is on track to see more overdose deaths in 2020 than in 2019 and possibly set a new record. That's according to the third quarter drug overdose report released this week.
And for some of us, those numbers may just be that, numbers. But to those who work in recovery every day, there's so much more. News Center Maine's Chloe Tebow spoke to some of them. Hi, Chloe.
Hi, Sam and Sharon. Good morning. Yeah, this upward trend in drug overdose deaths in Maine is information that's hard for a lot of us to process, but it hits especially close to home for recovery centers and sober houses working on the front lines every day. I spoke with two of them in Mid-Coast and Central Maine to find out what fighting this crisis during a pandemic has been like.
Overall, the recovery community has been hit unbelievably hard.
Teresa Mastrocolo is the supervising manager at the Mid-Coast Recovery Coalition's Women's Recovery Residence. She says 2020 has been a year unlike any other. For the most part, they've been full and have had successful releases, but that has come with increased responsibility.
I think that it's safe to say that we really functioned as caseworkers to get people settled.
Sometimes everything they did just wasn't enough.
You're gonna have to bear with me for a second. It's gonna get hard. This was our first year, 2020, that we had an overdose in a house and we lost somebody.
Mastrocolo blames new pressures on the coronavirus pandemic, which has created more isolation within a community that needs connection. In 2019, Maine had 380 overdose deaths total. On Monday, the Mills administration released the third quarter drug overdose report for 2020, indicating 380 total overdoses have been counted so far, and that's not including quarter four. Of those, 348 were accidental, 23 were suicides, and 9 were undetermined. The report also indicates an increase in drug deaths in Penobscot County, where James Rickroad helps run 7 Fresh Start sober living houses.
So it's been quite a challenge.
Rickroad says individual houses can hold in-person meetings, but crossover can't happen because of the pandemic. He says fewer options to connect with others has been difficult for some.
We've seen a lot of people who normally make regular meetings, daily, and that's a huge staple to their recovery, not make meetings.
Sometimes that decision can be costly, and as a reminder, every number has a name.
If you can't remember to put a face on it and to humanize what's happening, then I don't think that we're gonna make the right decisions on how we can help prevent it.
Now, if you're in need of help, there are resources available. You can start by calling 211 Maine to be connected to things like support groups and relapse prevention services in your area. Live in studio this morning, Chloe Tebow, News Center Maine.